How do therapists treat trauma?
Primarily looking at the relationship between therapist and client. That relationship should be healing. You should feel safe with your trauma therapist. You should feel like you can give feedback and ask questions, particularly if we're looking at complex trauma. There's this saying, we're born into relationship, we're wounded in relationship, and we're healed in relationship. And your relationship with your therapist is part of that healing. So it's not good enough to have a just okay relationship with your therapist. It should be a strong one where over time you build trust. If you walk in the first session, you're like, oh yeah, I trust this person. Let's get curious about why. And then from there, it's going to be so individualized. All trauma therapy modalities are going to have some element of stabilizing, resourcing, building up your capacity for talking about and handling, and then walking you through what happened. And through different modalities, whether that's eye movement desensitization and reprocessing, or trauma-focused cognitive behavioral therapy, somatic techniques, internal family systems, all of them have their own spin on how they actually, like the actual mechanism of change there. Oh, I forgot Brainspotting is another one. But you should be able to ask your therapist like the details, like, hey, so what's actually going to happen in this modality? And they should be able to tell you in plain language. If they're kind of vague about it, you can keep asking. You can be like, hey, this is really hard for me. I'm putting myself in a really vulnerable position. And like, I want to know that you have like a map of where we're going. Everyone's map is going to be different because everyone's trauma is different. It's very rare that we get like a textbook case where it's just like open and shut.
Right.
5 sessions.
Yeah, that would be lovely.
Yeah.
You started that statement saying that your relationship with your trauma therapist has to be strong. You didn't just say therapist. How does somebody know if they're going online or if they're talking to a friend who says, I have a great therapist, if that's going to be a person who would help them with trauma as opposed to some other specialty?
I mean, trauma is so pervasive. I would hope that most therapists have some tools in their kit because I don't think I've had anyone ever come into my office without some level of trauma. Now, maybe it's not having an enormous impact on them day to day. But again, like that's kind of like being a therapist and saying like, oh, I don't do relationship stuff.
Okay.
But there are some people that have sought out more training and, kind of engage with it a little more intentionally as far as like, I'm part of an ongoing consultation group for therapists that do EMDR and like really wanting to be grounded in that trauma modality. You can ask all the questions in the world about that. I would do it in a way that is like building the relationship with your therapist. So like rather than just like rattling off all your questions, like to actually do it as part of a conversation. And because sometimes I'll get a phone call and it'll just be someone like with a list of 10 questions. And I'm just like, oh, like what article did they read? And they're like 10 questions to ask your trauma therapist.
AI.
Or AI. Which please don't process trauma with AI. Ask all the questions that you can. And while you're doing that, building that relationship and saying like, hey, this is really scary for me. And one of the ways that it's going to be less scary for me is like knowing what to expect or kind of like knowing what's coming or knowing what the map looks like. And once I know what that looks like, I think I'll be able to like actually sit down into it.